Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, advancing research to treat and cure ALS, plus how the gender of a researcher can influence how mice respond to certain drugs. But first, a $13.7 million grant from the NIH will promote faculty diversity from underrepresented groups in science and medicine. Dean Gladwin says it's important for the faculty to represent the diversity of the community it serves.
Diversity is absolutely important for an academic medical center. Clinical research studies have clearly shown that patients from a diverse background are more likely to engage with healthcare, to follow through on things like vaccination, if their providers around them look like them or reflect their values.
The grant comes from FIRST, the Faculty Institutional Recruitment for Sustainable Transformation Program. The grant will be shared in a collaboration between the School of Medicine and UMBC.
Now, University of Maryland, Baltimore County is a famous university, and they're famous for promoting STEM careers among URM students. In fact, they're among the top of the nation of graduating diverse STEM students.
The program will focus on training junior faculty by hiring 6 faculty members at the School of Medicine and 4 at UMBC. Each will have cross-campus appointments in research areas that have many opportunities for mentorship and collaboration.
These hires will be so-called cluster hires, in which the faculty come in defined groups, clusters of research. The 3 major areas that we're focusing on are cancer biology, neuroscience, microbiology, immunology, vaccinology.
The School of Medicine already has a strong STEM pipeline for middle school and high school students, as well as for college undergraduates, including internships and summer research programs and multiple postgraduate training programs for underrepresented scholars. The FIRST initiative takes that commitment to the next level.
I see us as being a magnet for attracting the most elite physicians and scientists from diverse backgrounds.
In our Discovery segment, School of Medicine researchers have shown that mice respond more to the antidepressant effects of the drug ketamine when it's administered by men and not women. It's important because ketamine can treat life-threatening, treatment-resistant depression.
Ketamine, which has previously been used as an anesthetic for decades, if you give it a sub-anesthetic dose to individuals with treatment-refractory depression, that it can rapidly reverse and sometimes eliminate depressive symptoms.
Researchers demonstrated that the effectiveness of ketamine in mice is dependent on handling by men.
We conducted a blinded randomized experiment where we compared a male experimenter to a female experimenter, and we found that the male experimenter, when he administered ketamine, found the typical effect we'd been seeing for years, and the female experimenter didn't see the expected effect of ketamine. And then we went forward and repeated that with a number of pairs of male and female experimenters and found the same thing every time.
While the influence of the sex of the scientist is not directly relevant to the human response to ketamine, understanding the mechanisms involved could suggest ways to improve the therapy for people who do not respond well. After his diagnosis with amyotrophic lateral sclerosis, triathlete John Blais made history by competing in the Ironman triathlon, raised awareness about ALS, and fought for research funding. And now the Blaisman Foundation for ALS has given $800,000 to the University of Maryland Brain and Tissue Bank to advance that research.
We have a mission to identify and recover brains from donors post-mortem who have all manner of neurological or psychiatric disorders, dementias, motor disabilities, intellectual disabilities.
Blais, who passed away in 2007, donated his brain tissue to help find a cure.
ALS is it's a devastating disease. It strikes adults and it is a death sentence. And it's a terrible disease which results in loss of muscle control, initially the hands and limbs, and eventually your ability to breathe. And there is no cure. And there is a great need.
The bulk of the money will be used to support ALS research around the country that could lead to a treatment or cure. The donation will also support an annual research seminar in honor of Jonathan Blais.
We're grateful to Bob and Marianne Blais. They're just a wonderful pair of individuals who have been very generous to us over the years, and we are happy to help keep the memory of their son, Jonathan Blais, alive, who really went the distance in raising awareness and turning his diagnosis into something extremely productive and noteworthy.
And that's Frontline News. I'm Larry Roberts. Thanks for joining us. We'll see you again next time.